door, the patient allows me in. I introduce myself. Hello, my name is Anessa. I'm going to go ahead and be your nurse for today. I'm going to go ahead and do hand hygiene. I'm going to ask the patient to confirm their name and date of birth while I check their wristbands. Okay, that was confirmed. I'm going to go ahead. I have a doctor's order to do a sterile wound change for you today. Are you experiencing any pain? The patient will let me know that they're not in any pain. Okay, do you have any allergies? They're going to let me know they don't. Do you have any allergies to latex? The patient confirms that he has no allergies to latex. So I'm going to go ahead and continue with my sterile wound change. First thing I'm going to do is raise the bed to my height. I'm then going to put the side rails down, and then I'm going to go ahead and position the patient. Okay, and then I'm going to go ahead and take the waterproof pad and place it underneath the patient. Okay, after I do that, I'm going to go ahead and open my sterile kit and grab this red bag, which is going to be used as my trash during the duration of this. Okay, and then next thing I'm going to do is I'm going to don on gloves. So I need to make sure that I only touch the inside of it so the gloves remain sterile. Okay, so I'm going to go ahead and remove the dressing, and I'm going to do this by doing the push and pull method to prevent any skin tearing or skin irritation on the patient. Okay, and after that is finished, I'm going to go ahead and assess it for coca. So that's the color, odor, consistency, and amount. So I'm going to note that the color of this is brown, the odor, there's no smell, the consistency is thin, and then there's dime-sized amount. Okay, and I will remove that, and then I will do it for every piece of the dressing that I assess, and I'm going to go ahead and toss it in the trash can. And then I'm going to go ahead and take a sterile Q-tip, and I'm going to look for the deeper parts of it, and then I'm going to go ahead and place it in. I'm going to note it with my finger, and then I'm going to take my measuring device, which didn't come in my package, but it measured in centimeters. And I'm going to measure that, and I'm going to go ahead and note it. And then I'm going to look and assess for any tunneling or undermining, and I'm going to do this by taking the sterile Q-tip and locating the deepest parts. And then I'm going to note this using clock terms. So at 12 o'clock, 2 o'clock, and 9 o'clock, I noticed the tunneling. Okay, after I do that, I'm going to go ahead and toss that. And then I'm going to go ahead and toss my gloves as well. I have to reuse these gloves because my kit only came with one pair of gloves. So usually we would toss them, but I'm going to put them to the side because I'm going to go ahead and use it again. I'm going to go ahead and perform hand hygiene once more. And then I'm going to go ahead and start setting up my sterile field. So these would be closed, but I was practicing, so I have them open. I'm going to go ahead and take this without fanning it and only holding the edges. I'm going to go ahead and place it down. And nothing would be on this table to start, it would be on a separate table. And then after I do that, I need to set this on top because it's going to fly because I have my fan on. So I'm going to perform hand hygiene, and then I'm going to go ahead and don on my gloves, which I'm going to use sterile techniques as well and keep from touching the outsides of it. So after I have my gloves on, I can then touch my sterile equipment. Okay. And then I'm going to go ahead and just start to rearrange my area. I'm going to rearrange my area. Okay. Okay, so after I do this, I'm going to take the packing. I only have one right here, so I'm going to have to reuse this one. Okay, so I'm going to take the packing. And then I'm going to pour the solution into this, and I'm going to use one of the dressings and put it in there and let it soak for a little bit. Okay, and then I'm going to begin by irrigating the wound. I'm going to take my forceps, and then from the least contaminated to the most contaminated, I'm going to go ahead and begin irrigation. So it's from the top to the bottom. Can you see that I'm doing this? A little bit closer. You can just show this. So you're going to do it just from the top to the bottom. After you do that, you're going to go ahead and toss both things. And then you're going to go ahead and take another piece of the dressing, but I don't have lots, so I'm going to use this again. And then you're going to go ahead and just clean the edges. So this isn't going inside of the wound, it's just going alongside the edges. You can come closer and do it right here. So it's going to just go alongside the edges. After that, I'm going to go ahead and toss that. And then this is what is going to go, so this one is going to go inside of it now. And this is going to go inside of the wound to check for any residual draining. After I do that, I'm going to go ahead and toss it. And then I'm going to go ahead and take the packing from the solution. I'm going to go ahead and drain it out. Okay, and after I do that, I'm going to go ahead and open it. And this is what I'm going to use to pack the wound. And how I'm going to do it is it's going to fan in my hand. And I want to make sure that this doesn't touch anything. If it ends up touching the outside of the wound, I'm going to go ahead and have to restart. And then I'm just going to go ahead and pack the wound. And then what I'm going to do is I'm going to take this, so after I pack it and I apply another one on top of it, I'm going to go ahead and take off my gloves. I'm going to perform hand hygiene one more time. And then I'm going to also don on a new pair of gloves. Okay, after I do this, I'm going to go ahead and take the ABD pad with the blue line facing upwards. So I'm going to place it directly on top. And then I'm going to use the hospital tape to tape the sides of it. When I'm taping it up, I want to make sure that I use as little tape as possible to prevent skin irritation or tearing for the patient. Stuck on my finger. Okay, so I practiced a lot, so I don't have that much tape, but I would tape all four corners so that it's stable. And then after that, hospitals either have labels. If they don't have labels, I'm going to go ahead and take another piece of the tape, place it on top, and I'm going to initial it with my signature, the date, and the time, just so when other doctors and nurses come, it's documented. Okay, after I go ahead and do that, I'm going to ask the patient how they are feeling, and then I'm going to go ahead and reposition and kind of get him back to normal. So the patient says that he's feeling okay. I'm going to go ahead and reposition the patient. I'm going to go ahead and remove the waterproof pad. And then everything is going to go into the bag. So everything that was used would be trashed. And then proper disposal of the gloves would be I would tie this up, and then I would use my hand, this, to remove this one, and then this to remove this, so that I'm touching the inside of the glove and nothing dirty is being touched. Okay, so then I'm going to go ahead and dispose of that. And then I'm going to go ahead and perform hand hygiene. I'm going to raise the patient's rails. I'm going to lower the bed down to the lowest possible level. And then I'm going to give the patient the call light and let him know that I'll be back in a few minutes to reassess and see how they're doing. And then I'm going to go ahead and perform my last hand hygiene.